If you are ever faced with an emergency situation where somebody has collapsed and there is no doctor to be found in sight, what are the things that you can do that can potentially help save their life? The first thing to do is call for help, call for an ambulance, make sure that the scene is safe, and finally ask for an automated external defibrillator. Step 2 is check if they have a carotid pulse and intact breath sounds. You can feel the carotid pulse on either side of your windpipe with 2 fingers pressed tightly just at the side of your windpipe. You can observe the chest movement or try to put your ear to their chest and hear breath sounds to know if they are breathing. If the pulse is present but the breathing is abnormal or absent, try to open the mouth of the patient and see for any object or something that might be obstructing their airway. You may also have to give mouth-to-mouth breaths, which would be 10 to 12 breaths per minute, and continue to monitor their pulse. If the carotid pulse is absent, you need to start CPR immediately. Put your left palm over your right hand like this, interlock the fingers together, and use the heel of your palm and place it at the center of the chest, the bony part that you can feel, which is the sternum. Place your hand over the center of the sternum at the level of the nipples and start to compress. You need to give 100 to 120 compressions in a minute, which should be around 5 to 6 centimeter deep, and allow for adequate recoil of the chest as well. After every 30 compressions, you need to give 2 rescue breaths to the patient via mouth to mouth, which will be of 1 second each, and while you give the breaths, you will see the chest of the patient rise. The next step is to ask for an automated external defibrillator if one is available at the site. If yes, all you have to do is put the paddles of the defibrillator as explained on them on the site of the chest. So it will be mentioned on the paddles where you need to put these on the chest. Place it according to that. Turn on the machine and it will instruct you whether the rhythm is shockable or not. If it is shockable, it will ask you to deliver a shock. Make sure that everyone is clear. Nobody is touching the patient while you deliver the shock. If it's a case of a drowned patient and the body is wet, make sure that you adequately dry the area with a towel before delivering any kind of shock. Once you've delivered a shock, immediately restart compressions and continue the same process. If the machine says that the rhythm is non-shockable, you do not need to deliver the shock, you just need to continue with the chest compressions and rescue breaths. Knowing this basic life support protocol can actually help you save a life someday in case a doctor isn't around.